on the screen. But if maybe when I mention you, please do give us a little wave so we know who you are. So first of all, Professor Sir Graham Thornycroft. Professor Thornycroft is a professor of community psychiatry at the Center for Global Mental Health and the Center for Implementation Science, Institute of Psychiatry, Psychology and Neuroscience at King's College London. Now, Graham has made significant contributions to the development of mental health policy, not only in England, but also globally. He chaired the World Health Organization Guideline Development Group for the Mental Health Gap Action Program, and he also co-chaired the 2022 Lancet Commission on Ending Stigma and Discrimination in Mental Health. Welcome, Graham. Next, we have Ben Adams. Ben works for the World Health Organization, where he supports the Special Initiative for Mental Health Program and work on suicide prevention. And prior to this, he worked as a senior mental health advisor for a global disability NGO, where he was the technical lead for mental health across Asia and Africa, and for mental health and psychosocial support network globally. He has supported the development and implementation of mental health programs, mental health law, policy and system reform, and mental health research. We also have joining us Professor Winnie Mak from Hong Kong. Now, Winnie was born in Hong Kong and has lived in Los Angeles since she was 10. And having to constantly juggle between cultures and identities as an immigrant, Winnie experienced social anxiety disorder and persistent depressive disorder from her early teens to young adulthood. Winnie is now a professor in clinical psychology in the Department of Psychology at the Chinese University of Hong Kong, focusing her research on stigma, diversity, and mental health promotion. In 2015, she co-founded Storyteller, a social enterprise engaging people with lived experience with intersectional identities to eradicate stigma in the community. Welcome, Winnie. We also have joining us Kate Whitehead, who has worked as a journalist for 30 years and was formerly on staff with the South China Morning Post in Hong Kong. 4 years ago, she qualified as a psychotherapist, and alongside her journalism, she also works in private practice. She writes about mental health and was twice awarded the Mind Media Award for her stories on mental health. She has just completed Pandemic Minds, a book on the impact of the pandemic on mental health in Hong Kong, which will be published by the Hong Kong University Press in early 2024. I look forward to really reading that. I'm not sure if Meth Mali has been able to join us. Hopefully she has. I can't see on the screen, but she's also one of our panelists, and hopefully she can dial in. I know she's been having some connection problems. But Meth Mali Dissanayake is a journalist who works as a news editor at Ceylon Today newspaper in Sri Lanka. She specializes in writing about important topics like social issues, politics, and current events. In 2020, she received a prestigious award for her reporting on social development issues. She's also known for her responsible reporting on mental health matters. And last but not least, we have Hamza Ghaznavi, founder of Propaganda and PG Bazaar. He helped create Mango Bars, an entertaining viral digital platform. Propaganda is the most progressive social media outlet in Pakistan, and they have done some excellent coverage of issues around mental health and suicide. So maybe to start us off, Graham, the Lancet Commission on Ending Stigma and Discrimination was published almost a year ago. Would you be able to share with us some of the key findings and progress with the recommendations to date?
Yes, of course. Thank you very much, Enoch, and greetings everyone from a warm and sunny, unusually sunny morning in London. So first of all, this isn't only an academic topic for me, because I have family experience as well. When I was a small boy, my mother had a period of severe depression and she recovered, but she also experienced stigma. So to say a little bit about this special report from the medical journal called the Lancet, this is a detailed account, about 50 pages, about stigma and how to reduce and how to stop stigma. It was published a year ago on World Mental Health Day, and I led this report with my co-chair, Charlene Zunkel, who is the head of the Global Mental Health Peer Network. So why focus on stigma? Because it's a major barrier to social inclusion for many, many people with mental health conditions across the whole world. Few people who have mental health problems gain support to access or care. it has a negative effect on physical health care, leading towards early death for some people with mental health problems, and it has negative impacts on participation at school, in education, in the workplace, and on family life. So for this report, which is freely available and a Chinese version is about to be published, we did several things. We commissioned a special survey of people across the world, about 400 people in over 40 countries, including countries in the Asian region. And among the many important findings, one really struck me, namely that over 80% of people with mental health problems said that stigma is worse than the mental health condition. Stigma is worse than the mental health condition. But we also looked at the evidence of how to reduce stigma. In fact, we found over 200 detailed reviews of how to reduce stigma, and then we synthesized all that information. And it boils down to a simple, important point called social contact. The way to reduce stigma is to arrange for people who do have experience of mental health conditions to have contact with people who do not have that experience, either direct or indirect, for example, online or digital contact. So what is the role of the media then? In fact, the media has powerful positive and negative effects upon stigmatization. Negative when it reinforces stereotypes like dangerousness or unpredictability. Positive, for example, when it gives clear accounts of suicide following guidelines of good reporting. In our report, we made several recommendations specific to the media. For example, we suggested that all national and international news organizations should be called upon to issue policy statements, clear policy statements about promoting mental health and reducing stigma, and indeed should have these statements and plans in place by 2030, and that we should have regular surveys of all major news organizations to look at progress, to make the policy statements clear, and to check progress on the action plans for media involvement to promote positive mental health, not to sensationalize, not to exaggerate stereotypes of dangerousness, for example. So just in closing, a word about where we are. We now have a mechanism to follow up, to put into practice our recommendations. And I'm pleased to tell you that we're working very closely with the World Health Organization to produce a toolkit, a practical guide for people at different parts of the world, different levels of organization, a practical guide about how to reduce stigma. And that will be published by the World Health Organization next year. And just in closing, although stigma varies in different parts of the world, it looks like social contact works across the world wherever we have examined this. And recently I've done work with colleagues in Beijing and in Guangzhou, and social contact has again been effective to reduce stigmatization there. I will put my contact details in the chat line. Please do contact me if you'd like further information. Thank you very much for your attention, and back to you, Enoch. Thank you.
Thank you, Graham. And as you see, Faith has put in the link for the Lancet Commission on the ending of stigma and discrimination in mental health in the chat as well. So for those who are interested, you can save the link and have a look at the publication after the media roundtable. And indeed, I can speak from my own experience that when I went through depression, I was more worried about telling people about it. So self-stigma is also quite real in terms, and probably more serious than my own depression experience. Moving to you, Ben, can you elaborate a bit more on the importance of language and terminology when reporting on suicide? What would you say are some of the recommended guidelines that should be adhered to when journalists report, and so that we don't sensationalize, as Graham has mentioned?
Yes, thanks, Enoch. And hi, everybody. It's great to be here. Similar to so many of you, I suppose suicide has also affected me and my family in the past, and I've lost two loved ones to suicide. So this is something that I'm really quite passionate about. Can you hear me?
Yes.
Sorry, yeah, it flashed up on my screen that my connection is unstable, so I want to make sure. Yeah, absolutely. So I suppose, look, from the evidence, we know that media reports about suicide can increase the risk of further deaths by suicide, or they can actually help to provide information that may prevent other suicides from happening. So the language that colleagues in media use when reporting on or discussing suicide is hugely important. And the effect of media reports on increasing the number of suicide is quite common, and it's referred to, I suppose, technically as suicide contagion, and there's other terms to describe it as well. One being the Werther effect, which I would encourage people to look up. I don't have time to explain it now. But we really need to, as Graham has said, to avoid the use of language that sensationalizes suicide. So, for example, it's far more preferable to report on increasing suicide rates rather than a suicide epidemic. And a description that conveys the message that suicide is a public health concern, perhaps combined with a message about the prevention of suicide, can actually help to educate the public and serves as a suicide. And aligned to this, I suppose colleagues with responsibility for headlines really need to use non-sensational language. I suppose in addition to this, language that misinforms the public about suicide or normalizes suicide by making it appear that, you know, suicide is a common reaction to life circumstances or distress, or language that provides simplistic explanations for suicide really need to be avoided, as they are much less likely to be misinterpreted. And actually, they contribute to the destigmatization of suicide. And as Graham even discussed, you know, this is really important because stigma is a form of discrimination, as we know, and it actually results in people avoiding seeking help, which again can lead to suicide. As we all know, suicide has historically been criminalized in many countries and remains a criminal offence in some countries today. And the phrase committed suicide implies, I suppose, criminality and unnecessarily also increases the stigma experienced by those which like died by suicide or took one's life. And finally, I think the media can play a really significant role in either enhancing suicide prevention efforts or weakening them. And I would really hope that media would strive to support suicide prevention. And I think messages that all of us here can also remember to share is obviously, again, the message that Graham initially shared around sensational language and not to use it. Also, not to use language that normalizes suicide. Or presents it as a viable solution to problems, to always discuss the facts and not the myths about suicide. So we know that there are a lot of myths out there that are unhelpful, and to provide really accurate information which could actually be seen as educational and to support suicide prevention. And finally, I think sharing or promoting stories about overcoming a suicidal crisis or people who have overcome suicidal thoughts and seeking help can really help to provide suicide. And much of what I have discussed is in a WHO resource called the Media Resource on Suicide Prevention. And the updated version of that is actually launching next Monday, so the day after World Suicide Prevention Day. And I really encourage people to have a look at that resource, to share it widely. It includes lots of do's and don'ts on reporting on suicide, how to actually support suicide prevention. The myths and facts that I spoke to, it actually gives an overview of some of what those myths are and the corresponding facts. And it also, this time in the updated version, really importantly includes a piece on social media and the use of new media in suicide prevention efforts. Thank you.
Thank you, Ben. And I think you addressed one of the questions in the chat from Chris Frederick on, you know, how media might tackle this issue. As you mentioned, you know, some countries, 22 countries, are still consider suicide as a criminal act. So as you say, hopefully the more we report this responsibly in the media, the more it can also help change some of the minds of these national policies and laws. And as you can see, in addition to the WHO media resources that Ben mentioned, Faith has also put into the chat the media manifesto that was jointly prepared by United for Global Mental Health and Global Mental Health Peer Network. That's also informed by people with lived experience in terms of reporting suicides in media. So if I turn to Winnie and thinking about people with lived experience, and Ben, you also mentioned that it's helpful if we share stories of those who have lived through suicide attempts. Winnie, for you, why is people with lived experience important stakeholders in advocating for ending mental health stigma and discrimination? And perhaps you would be able to share some of your experience and your own advocacy work at Storyteller.
Okay, thank you. Thanks for inviting me, because this topic is really personally relevant and highly meaningful to me professionally and personally. Maybe I'll share a little bit about what's going on in Hong Kong. In Hong Kong, usually the presentation of mental disorders and related challenges are often dominated by professional views. So which focus mainly on a lot of times on symptoms of mental disorder, with very little regard to heterogeneity of lived experience. So I think to me and also to Storyteller, the reasons why we use storytelling is, first of all, like Graham has said, is one of the ways to provide social context. And we actually have conducted research related to what Storyteller has done, and we do find that it has, significantly reduced stigma and promote attitudes and positive behaviors. So I think stories and narratives of people with lived experience are important because they shift the dominant narratives in the media and in the culture by providing hidden stories and what we call concealed stories related to people with lived experience. And oftentimes these kind of stories is related to stigmatization experience during the recovery process that are often overlooked and not mentioned by professionals. And stories also create a genuine connection with other people by raising resonance and interconnectedness that we're actually facing very similar challenges in varying degrees. And such relatedness actually makes advocacy more personally relevant and impactful. So people with lived experience can actually provide a very personal and direct experience to the public that humanize the discussion of mental disorders by challenging misconceptions and stereotypes, and by showing that every person with lived experience are actually unique. They have unique experience with their mental disorder, with their recovery process. And in addition to that, they also have numerous other roles and responsibilities that are often trivialized and ignored in the mainstream narratives, just focusing on the disorder. So I hope that through storytelling, we can humanize public understanding of people with lived experience, and that we and then provide a message that we're all human beings and have similar human experience, such that we can arouse empathy, compassion as fellow human beings, and then to advocate for each other and for themselves. So Storyteller is actually an organization, or we call a social enterprise, dedicated to using or harnessing the power of storytelling to raise awareness and to create social change. So in Storyteller, we actually members have intersectional identities. We have professionals, we have people with lived experience and cuts across different domains of lives. And through that, we share stories very mindfully with the intention that we want to get the message out that we need to reduce stigma and we need to promote mental health, because mental health is relevant to everybody. And we do that through different medium, through written narratives, videos, and public speaking engagement. And by empowering storytellers and others, we can be each other's advocates. It doesn't mean that if I can do it, you can do it. It actually means that we want to create or instill a sense of collective responsibility, and hope that if we put our efforts together, we can actually co-create a society that respects diversity and embrace well-being for all. So I hope that through this process of advocacy work, Storyteller can provide a sense of validation and support to each other, and also a safe space for people to share. So then we have mutual support and understanding, which we can further motivate and mobilize us to, to push forward towards advocacy. So we hope that through storytelling again and prevailing, changing the narratives, we can promote a more inclusive and compassionate society. And in the process of the past, let's say 8 years, we actually have witnessed a lot of transformation in the community, as well as our storytellers and the public. We did find, through our research and also through our experience, that we can successfully reduce stigma, promote mental health, encourage help seeking, and also foster a supportive and inclusive environment. So I hope that in the process, in the way forward, we can continue with this, interpersonal contact approach, so that more people can understand, who we really are as a person, as a three-dimensional human being, and that after all, we are all the same, and we all experience very similar experiences. Thank you.
Thank you, Wendy. I really love what you said in terms of experiencing the human in all its dimensions, so that we're not only defined by the mental health diagnosis that some of us hold. And we've heard quite a bit now on the framework and the reasons why we need to be reporting on mental health in a responsible way in order to help destigmatize the topic. I'd like to also invite now some of our journalists who are on our panel to share some of their on-the-ground experience in their reporting. And if I can turn to you first, Kate, I know you've been reporting on and writing about mental health for a long time. Could you give us some examples of reporting from your work that has been impactful in reducing stigma and advancing mental health? And let us know a bit your views on how the media can shape this narrative.
Yes, certainly. Before I give my couple of examples, I just want to say a couple of words, just that I know firsthand how damaging poor media reporting can be, because when I was 17, my best friend died by suicide. And I found out that she died from a front page story in the South China Morning Post, which is the newspaper that I report for now. And it was a super sensational story. And the way that she died wasn't just included in the story, it was actually in the headline in really big point size. And then an hour later, I was at school and loads of the students had seen the story and were talking about it. And her death and the reporting around that story definitely had an impact on me later. And that was in 1986. And then just over 10 years later, kind of in the late 1990s, I was in Hong Kong. I was a journalist. And that was when there was a spate of suicides on Chung Chau Island, which is an island just off Hong Kong, of charcoal burnings. And the way the local media reported that, it was clear that there was copycat suicides as a result of that. So it was very clear to me that media coverage was having a really big impact in the suicides. So after I qualified as a counsellor, it was only natural that I was going to write about mental health as well. And I think when you hear someone tell their story really authentically and honestly, then it's really clear that this is something that can happen to anybody, and it does, right? So I think we really need to have these stories out there, because talking about mental health demystifies it, right? And it takes away the fear. And when we've got rid of the fear, then we lose the stigma. As a journalist, when I interview someone about mental health, I actually don't go in thinking I'm going to write a mental health story, right? I kind of go in there thinking I'm there to hear somebody's story, to understand their experience, and then to write about it. So I let them start where they want to start, right, with the story. So I think it's really important to understand something of the person before jumping into the mental health issue, right? So when you've got a sense of the person and who they are and what they've experienced, then their struggle is totally understandable, right? And when that person feels that you're truly listening non-judgmentally, they're often going to tell you more, right? And those stories, those details are going to add color and depth to your story. And that person is going to feel like they're really heard and really want to share their story too. I also think when I'm covering mental health stories, I think it's really important to have the recovery story as well, because recovery is different for everybody and different things work for different people and they take different amounts of time. And so I think telling the recovery story really gets that message out there that recovery is something that's possible and does happen, right? And then it's a sort of positive upward cycle, because the more well-told stories we get out there, the more people are going to come forward and tell their stories and share their experience. So I think for journalists, the very first step when we're telling stories is listening, right? We're not thinking about writing or thinking about what we're going to write. I think we really want to start out by truly listening to the person who we're speaking to. So briefly, my example, so I did a I did a story immediately after the pandemic on pilots, because Hong Kong had perhaps the longest pandemic. We had a 3-year pandemic in Hong Kong, and the cargo pilots were caught in what was known as a closed loop system. So for 6 weeks at a time, they were basically being shuttled back and forth between getting off the plane and going to a quarantine hotel and back again. And the only people they would see would be the people on the plane and the people in the quarantine hotel, and they weren't with their family at all during that time. So of course they experienced mental health issues, right? And they needed to reach out and get support, but they couldn't because of this huge stigma around mental health, particularly in the aviation industry, and they're concerned about losing their job as well, right? So after I wrote this story, I actually had a lot of pilots reach out to me privately and just say to me that that story had circulated within the pilot community, and it had really allowed them to talk about the issue within the pilot community, which really said to me the strength of telling stories, right? That sometimes we get a story out there and then it allows people to talk about it. And actually one of the pilots that I interviewed for that story, he messaged me a couple of weeks afterwards, and he said that in telling that story and having the interview with him actually gave him the courage to seek out for counseling, which I think is fantastic, because the whole cycle was good of like sharing stories and then encouraging people to come forward so they can tell their story authentically. A story I did a couple of weeks ago was on Mind mental health, Mind Hong Kong, and they've got an anti-stigma campaign out at the moment. I interviewed 5 people for that, and part of what was that with that story was basically talking to them about what helps and what doesn't help, because I think oftentimes people want to support people, but they don't know what to do, or they don't know what to say, or they're so fearful of making it worse. So just giving tips and advice, I think, is really helpful. And just final point, if I may, sometimes I think the words mental health can be a little bit off-putting for some people, but when I talk about stress and depression and anxiety, people relate really easily. So just wanted to say something about that. But yeah, just basically getting lived experience stories out there is just so important in reducing stigma.
Very much so, Kate. And I think we can see that when reporting is done well, it really gives people a sense of permission and a freedom to also share their stories. And like you say, it becomes an upward cycle. Mesmali, can I turn to you? I know you're also a fellow journalist. Would you be able to share in your experience what you think is a useful model for covering mental health topics, including perhaps some of your achievements, but also maybe difficulties in the process? I'm not sure we can hear you well, Mesmali. No sounds coming through.
Now? Can you
Yes.
now?
Yes.
Okay.
Yes.
I'm Mesmali. I'm from for sharing my experience having some mental health. So I came to join.
And Mesmali, I think we're dropping off a little, your sound. I don't know if maybe if you try to speak a bit slower or closer to the microphone, it will connect better. Sorry about the connection problems.
Can you hear?
On and off. Is it the same for everyone, or is it just my computer? Yeah, we can't hear very clearly. Actually, if maybe we give Mesmali a few minutes to try to reconnect with the sound, and perhaps in this time what we can do is we turn to you, Hamza. Oh, okay, you're back.
What about now? What about now?
Much better, very clear.
Okay. Okay.
All
So when I was in treatments, actually, I understood that majority of Sri Lankans, including myself, we don't have much knowledge about mental health related issues, let alone the reporting. So then after I came to journalism, I started to cover mental health based on that personal experience. So the thing the things I have noticed, we in Sri Lanka, particularly both journalists and general public, there is lack of education. Actually, there's a lot of stigma related to mental health issues. So when I went to an interview with the director of National Institute of Mental Health in Sri Lanka, so she gave me lots of tips on how to report mental health related issues. So after I came back to my office, I talked to my editor. So this is what the director said. Can we apply these principles in our newsroom? So he agreed, and then we started to mention our mental health hotline, helpline, at the end of each news and each feature article related to mental health. So this is about like 5-6 years ago, and we were the first in Sri Lanka who started to do that. Mentioning mental health helpline. So now we can see many media outlets, they also do the same. So I think it is a really significant achievement. So I'm really happy about that. And also, if I speak about challenges, so when reporting mental health illnesses, even mainly the journalists too don't know about these reporting ethics and guidelines. We can see most of journalists who report about especially suicides, they sensationalize the story instead of focus on how to help, how to prevent suicides. They just focus on reporting the story in a sensationalized manner. So I think this is one of the main challenges, and it is really hard. Sometimes it's really hard to convince our fellow journalists, okay, so don't do this because this is really harmful to the society. So the lack of education is, I think, one major problem in Sri Lanka at the moment. But now I can see that when there's a group of reporters just like me, we constantly keep in touch and we improve our reporting on these topics. And now we can see that there's a very little improvement. But yes, we are continuing doing that.
Yes, and I think we can now hopefully follow that
yes.
model that you have started for other journalists to supervise each other in some ways across the region and even globally. Thank you, Methmali. Can I turn to you, Hamza, now? Because we've heard of some of the challenges in the media, and we also know that social media, which is your space, is often a breeding ground for misinformation, and especially some of this misinformation can be the kind of information that goes viral, and this is particularly harmful when it comes to this topic. So can you share some recommendations on what we can do for other content creators so that we promote positive content responsibly on social media?
No, for sure. And thank you for having me. I think everyone in this room is way more smarter than me and has more information. So I'll try to share my limited knowledge. So one of the things that we've noticed, at least inside propaganda, 3 things that I think are important to talk about is, misinformation, people going after reporting sensational news versus positive news, and how we also define ourselves on social media. So one of the things I think everyone knows, there's a lot of misinformation on social media, but it's not that it's an impossible problem that cannot be solved, right? There are certain standards that can go in. And I would also I would say Facebook and all these platforms have policies inside North America for catering to some kind of misinformation and whatnot, but I feel those policies are almost negligible when it comes to Asia and when it comes to at least Pakistan or South Asia. I think that definitely needs to be catered to. I think one thing that we can also actually take is, I feel Twitter, or well now known as the X platform, is doing a good job in, now adding those kind of context when something is reported, hey, this is false, this is not. I have noticed it, if you compare that to Instagram and Facebook, that is not present there. And I feel the other problem is, even on a content creator point of view, you need to understand. So when somebody opens like a platform or even a a news platform, whatnot. The problem now is that everything is so based on the numbers. Like everyone has to prove numbers to their editor, right? Even if you're a news platform and you have a social media presence, your editor is not just coming after you for a great story, but also coming after you for a viral story. That's where the problem arises. When you go after a viral story, you're going after numbers. You're going after sensational headlines. And even if you are a good journalist, the problem is you won't get a promotion, or your story won't bypass if a bunch of people aren't reading it. So I feel the problem is not one fault. The problem is not even one person's fault. It's coming from it's part of it is from the organization. It's a part of it is also how people are perceiving it. Look at COVID, for example. I think COVID is a great example. When everyone was, inside lockdown, there was a lot of this shocking, sensational news about COVID, which also I feel added to the panic, right? And there was this move that was created by people. Like if you imagine during COVID, people started talking about mental health more. Like even in Pakistan, people were talking about it. Yeah, man, this is because everyone was suffering. Everyone was locked down. Everyone was okay, there's something off. This is not, we need to change this. And I feel we had some support at that point. And we saw this real dichotomy before, people who were trying to push for this shocking news because that was getting the numbers, but was also massively depressing. So I kind of saw that kind of shift in platforms there. And a third point is also how you define yourself. So, I feel a lot of these social media platforms right now define themselves on an object, and it's mostly shocking elements. This is a platform that hates a certain political party, or this identifies as a progressive platform or a conservative platform or whatever, or something in between. I don't know. But when you start identifying as that one kind of thing, that adds a lot of hate, and that becomes a hate breeding ground, because you're only preaching to a choir, and that choir is also bunch of people who also have a lot of hate filled in them and are angry people. And in countries and especially these days where there's an economic collapse happening, there's so much things happening, it's very easy to play on people's these kind of things and get those reactions from people. And I think that's what social media has gotten. It's the place where you're trying to get reactions out of people. I do feel there's a solution to it. It's not like there's no solution to it. You can look, in the end, a lot of the social media platform also want virality, but also want to monetize their content. And you can place restrictions on people who are producing fake content. You can put certain restriction on the kind of content. So if the content is coming to maybe Canada is an extreme example, but you saw Canada now banning news on on Instagram. You can't now have news being displayed. But that had a flip side, because when there was fire in BC, Trudeau was no, that doesn't make sense. We need to inform people. So I feel it is a complicated cycle, but the solution also in part, yes, is with the social media platforms, but it's also with these big giants like Meta, X. What are they doing about it? Yes, we can go to a further debate on how social media shouldn't be monopolized, but I feel none of us have time for that right now. But I think on the last front also, I think some positives have come out, and kudos to WHO for doing this. So for the longest time, suicide was criminal in Pakistan. It's not now. So ever since last year, suicide is not criminal. And I feel that does add. So I think initially it was Graham who talked about stigma as worse. Completely agreed. Stigma is much worse. And I think a lot of these problems come with stigma. So one, I know we have reported on things which the person, there was a student who had committed suicide there's a university in Lahore, Beacon House National University. And I remember we got a call for not calling it a suicide, because it's social, it's such a big taboo that their family did not want to associate that their child or whatever has committed suicide. Now I feel that's a problem, because we are because we don't know if even people are committing suicide. We are saying no, because somehow the taboo is a much bigger problem for us than catering to the issue that why did your child commit suicide? What went wrong? So I feel it's a problem coming from all fronts, and for the solution, we all need to do something.
Yes, and I think, Hamza, you point out something very important, that in terms of content creator, we have responsibility, and perhaps there's also some sort of responsibility for the audience, whether we click that repost button or whether we like a certain post, but then we also need to start somewhere. in terms of responsible reporting. And we've heard from all our panelists, and I'd like to spend some time with questions and also discussion and open it up to those of you who are also online. I've been receiving some questions in the chat, so please do keep them coming. And I think, Amanda, you wanted to make a comment or a question first. Is that right? Amanda Lee from Storyteller.
Oh, hi, everyone. Thank you very much for giving me some time to share some of my thoughts. So thank you for all the sharing. It's wonderful to see some familiar faces here, actually. So there are two things that stand out to me, and I would like to bring it to your attention. So first, to support responsible reporting, I think it's also important to talk about the journalist ethics as well. So as Kate also mentioned, how to be an empathetic interviewer is really actually important. And we need to ensure that we have informed consent and ensure the truthfulness of the story, and really approach the interview and reporting with sensitivity and empathy, and actively avoiding harm, which is actually quite common in the process of like being interviewed as a storyteller. So these elements are not only important for journalists, but also for people who want to share their stories in the media, and also for organizations who want to prepare people to share stories as well. So I think these ethics considerations should also be like discussed further as well. So another aspect is that I'm thinking we may need to discuss in relation to stigma reduction. We need to talk about like their stories can actually perpetuate stigma in some sense. So we need to discuss what stories are actually helpful in reducing stigma and what stories are actually perpetuating the stereotypes. So I really hope to have more discussion on that, and which is quite important. So it's not just about telling story. We have to know that what elements are critical in the storytelling. So yeah, these are the two things that I'm thinking at the moment. So really hope to listen to more sharing and insight from all of you. Thank you, Enoch, and everyone.
Thank you, Amanda. And it is a very good point in terms of, how do we also protect the people who speak out about their stories as well. And there's a question in the chat from Oneza. I think you say, there are some different perspectives or using storytelling for effective advocacy around suicide prevention. And I think the question goes to the panel, are there any resources or perhaps your advice on how we can also protect those who speak out, whether it's on social media platforms or also in some of your interviews, because we know that they're sharing a big part of themselves. Would any panelists like to address this question? Yes, Graham, please.
Thanks. So just a brief comment about the types of stories which are really very powerful to reduce stigma. And as Amanda said, it's not any story. There are several qualities that are particular to active stigma reducing stories. For example, that they focus upon recovery. So in my own experience, I work with people who have an episode of psychosis, maybe hearing voices, maybe seeing visions, and the large majority of people recover. Many recover fully within a year or two. So recovery in the stories is a really important point. But of course, people's individual recovery journeys, if you like, are quite different. So it's the specific individual stories of recovery. The other thing is a little bit more technical, which is that the most effective stories seem to moderately disconfirm stereotypes. So what does this mean? It means that it's not a story saying, I was depressed for a year, but then I made billions through being an IT tech consultant and so on. Nor is it a person who's been chronically depressed for many years and is completely self-neglectful. But it's a real story of people struggling with challenges, with support, or sometimes with disclosure, and then navigating a way back into full participation in everyday life. So recovery is important, part of the story, and disconfirming the stereotype is also very important. Thank you, Enoch.
Thank you, Graham. Actually, can I keep you on for another minute? Because I think there's a follow-up question that perhaps you can give us some insights on from Sanaa Hamad around what might be the impact evaluation measures we can use to gather evidence that positive reporting can help with destigmatization. Would you be able to give us some insights on that?
Yes, I can. So let me give you an example. I didn't mention this, but they're now in about 12 or 14 countries around the world, national level or territory level, anti-stigma campaigns. And many have used ways to address and to assess the impact. In England, we had for 14 years a national program called Time to Change, and we looked specifically at reporting. We analysed the content of 14 newspapers. 7 were national and 7 were local every year over this period. And we distinguished between anti-stigma and pro-stigma content in the newspapers. Now it can be done electronically, of course, very easily. And what we found is that over that time, there was a trend. It went from more stigmatizing to less stigmatizing content. And then at the end of the campaign, the majority of the content in the newspapers was non-stigmatizing. So we would see, for example, big headlines saying maniac, psycho, murderer, and that disappeared. And we saw many more individual stories about people experiencing eating disorders, panic attacks, phobias, and so on, but not that that was their master identity. This was just one of the characteristics or experiences in the complexity and the richness of their lives.
Thank you so much, Graham. Yes, Kate, you wanted to add to that?
I wanted to say, in terms of, as a journalist, when we interview people, that I always feel there's two kinds of people you interview. Either the person who's got a very well-polished story, you know, they've had their cover story, maybe they've ended up making a business out of it or written a book about it or something. And I interview quite a lot of those people often because, you know, they're in the media. And then I interview people who are totally fresh. This is maybe the first time they've told the story. And almost I feel like I'm working with them to kind of craft it and work out their narrative. And I know that Amanda Lee and Winnie at Storyteller, that's part of what they do, helping people tell their stories and get the narrative. And that is very healing in itself. But just that journalists, I think, need to be aware of what you're dealing with. Are you working with somebody who has polished the story? And if they haven't, to just really go easy on them and be part of that process with them as they work it out, because I think it can be quite scary the first time you tell your story.
Very much so. I still remember my first time and I still get jitters as well. Winnie, you wanted to add to that?
Yeah, I want to add to that I agree with Kate that I think we need to prepare the storyteller in terms of their disclosure decisions. At any point in time, they can always decide not to disclose or not to share. And journalists need to respect that instead of pushing the person to share more and disclose more at the cost of that person's, and that makes them very exposed and very, very vulnerable. And on the storyteller side, I think we also need to be very meticulous, and also we need to contemplate on how ready we are and what kind of disclosure we are ready to share outside. And Pat Corrigan actually has developed a honest, open, proud protocol that is readily available to free for everybody. And Amanda actually has adopted that into Chinese, local Chinese. So I think it's something that we can, look at and see how we can support people to share their stories more effectively as well as more cautiously.
Yes, thank you, Winnie. And in supplement to that, Ben has very kindly put into the chat quite a few different types of resources that we could all access around not just WHO guidelines, but also other organizations that has best practices for example, for online technologies in that space. So I do invite you to have a look in that. And perhaps, I'm not sure if this question might come to you, Ben. There's a question in the chat around access, and maybe perhaps also equity and access to mental health resources and awareness, especially in some countries who don't have the same access as some of the countries who have more resources. So as the media starts creating more awareness and more journalists want to report on the topic, how do we then deal with that influx of demand, and how do we ensure we've got that access of information for them?
Yeah, absolutely. Sorry, I'm just jumping to the previous question very quickly, but just to add, I think we also need to remember to look at it from the other perspective as well, as I suppose the duty of care that social media or media platforms and organizations have to protect those who are posting stories and sharing content. So I think it's really important for those of us working in mental health or media with a keen interest in mental health to remember that we have to be advocating, ensuring that regulations around in what way, for example, does Instagram or Facebook deal with negative comments of somebody who has made a disclosure about mental health? And how do they ensure that there are safeguarding and protective measures in place to support those people? But just on the comment you actually asked me, I think, yeah, look, I think with access, this is always a conversation across mental health and not just specific to, stigma or to suicide. It's a bit of that kind of what came first, the chicken or the egg, in especially in contexts where you have very limited service availability or supports available, and then you start to increase demand. Or, you often see the other problem where you start to actually increase service availability, but there is no demand because awareness is so low. And I think one thing is obviously that we all working in this area need to encourage that both, as much as possible, happen simultaneously, so that we're both working on increasing awareness, which in turn increases demand, but also working on ensuring that services are available, and starting with the most basic, so at least people can avail of basic supports. I also think in situations where maybe that doesn't happen, and that's quite frequent, and maybe where awareness raising and increasing demand is what comes first, it's also about how you correctly channel that. So ensuring that demand is monitored and is used for advocacy, and actually demonstrating, I suppose, to the powers that be, for want of a better word, that services are required. And I think, look, this is part of a bigger ethical conversation, as I said, in terms of what do you do first. But as I said, I really think it's important that for the most part, those especially working in service development and service strengthening, do both dually or partner with other organizations who can fill a gap maybe that they're not able to address. Yeah.
Okay. Thank you, Ben. And we're slowly coming to draw close to the media roundtable. And at this point, I'd like to invite our panelists to also, in the interest of time, to give us one line closing remark. And perhaps as you prefer, there has been a question in the chat around how do you look after your own mental health, especially if the reporting becomes stressful or not. So if you prefer in your closing remark, if you might also want to address that, I understand that might be something personal. So shall I start with you, Graham? A closing remark from you.
Thanks. So just 2 quick points. One is that the evidence shows it's this social contact, interpersonal contact, that works against stigma. And the other thing is about what words to use to refer to people who have different emotional or mental health experiences. And the answer, I think, is to ask people locally where you work about which terms are respectful and which terms are offensive, and to be guided by people with that lived experience. Thank you, Enoch.
Thank you, Graham. Mali, are you still with us? Would you like to give us a one-line closing remark?
Yes. So what I want to say is thank you very much for organizing this panel discussion. So I also learned lots of new things. So what I want to say is particularly in when we, like in Sri Lanka, we have we are a diverse country, so there are 2 official languages, Sinhala and Tamil. So this is what I noticed analyzing all the media reports. So when it comes to ethical reportings, English language papers they are more ethical. They focus on ethics, but not the local language newspapers. So they are the ones who mainly sensationalize the stories. So I think when speaking about making resources available, there should be resources in local languages, so the local journalists they can understand the topic better.
Very much so.
So yes. So
thank you. Thank you, Mali. Ben, can I turn to you?
Yeah, sure. The first thing, obviously, I want to say specific to suicide is that it is preventable. And I think if we can all even just get that message out there, it's really helpful and instills hope. And secondly, I think that any media professionals who write stories of resilience and overcoming suicide, such as those that we have discussed today, can make a really critical contribution to suicide prevention. Thank you.
Thank you, Ben. Kate?
One thing that I'm always saying, work-wise, but also among my friends, is just trying to normalize mental health, right? And just when you know that 1 out of every 2 people is going to have a mental health issue at some point in their lifetime, just really helps to normalize it. And so we need these stories out there so that when someone does have a mental health issue, they have the courage to seek help. And also for people who are having a mental health issue, it just helps to take away the fear and the stigma. And then in how I really help myself is I do something called TRE. I don't know if people have heard of it before. It stands for tension releasing exercises. I do it myself personally. I do it every day. I love it. And I teach people to do it, usually often in groups. The soldiers in Ukraine have just been learning how to do it, which I think is fantastic. So TRE is my kind of go-to for mental health and staying de-stressed.
Thank you, Kate. And last but not least, Winnie.
I often remind myself of interconnectedness in the sense that we are all in this world together. So we have the potential and the power to co-create a society that we thrive to live in. And I hope that we recognize that mental health is important for everyone, and we all, have this, a potential challenge. So hopefully we can all work together and advocate for each other. For my self-care, I mainly meditate, in the morning and in the evening, focusing on how should I say, non-attaching myself to different issues and to recognize that everything is impermanent, but at the same time is interconnected. Thank you.
Thank you, Winnie. And Hamza unfortunately had to log off a bit early, but he's asked me to send his regards and thanks to the organizer, and thank you to the audience. And indeed, a big thank you to also all our panelists who've shared a lot of their experience and stories. And I'd also like to thank United for Global Mental Health for organizing this media roundtable, Faith, who has been the force behind it, and Faith and her team as well, who's organized this very well. And the last thing I'd like to remind us as well, if you're interested in continuing this discussion, please do look at the Global Mental Health Action Network Communications Working Group. I know Faith will put the link on the chat as well. You can join these working group and meet like-minded people and think about how we can foster a more responsible and empathetic understanding of this topic, remembering that these are people that we're reporting about. Thank you very much, and look forward to continuing this discussion at another time.
I think it's just the three of us now. Thanks.
Yeah. That went really well. Congratulations, Faith.
Yeah, thanks for all the help.